Good afternoon. This is Dr. Christine Sauer, your host of the show Healthy Alternatives, here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk, mostly with guests, about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, don't give up. There is a light at the end of the tunnel for you too. Hello everybody and welcome to Healthy Alternative here on YouTube. And today I am with Pascal Groleaux, who is one of the most knowledgeable osteopaths and way more than that I know. He's not only an osteopath in Nova Scotia, but he's also a worldwide researcher and a neuroscientist. Welcome, Pascal.
Welcome, Christine. How are you?
I'm great.
Thank
so we
you
already had a show before, and we were talking about you and your education and how it is different from that of regular osteopaths. And today we want to talk about something that's really a specialty of yours. It's called vagus nerve stimulation.
Yes, indeed.
Tell us a little bit about it. What is it? People usually don't know nothing about that.
So vagus nerve stimulation is meaning to stimulate the vagus nerve. So what is the vagus nerve? It's the longest cranial nerve and that innervates almost all organs in the body, but also send information to almost 80% of the total volume of the brain. So it's very powerful neurophysiological, endocrine and immunological effect in the body.
So what people don't know is that we have a vagus nerve and we have a sympathetic nervous system, and those are players that play against each other, right?
Yeah, so let's say we have three autonomic nervous system. The most important are the sympathetic, which is the flight or fight that everybody knows, to deal with stress. And on the other hand, we have the parasympathetic, which is the rest and digest, which counterbalance the sympathetic. The vagus nerve is the most important or component of the parasympathetic. And then we have also the enteric nervous system, which is also autonomic nervous system that make part of the connection with the brain and the gut. But the vagus nerve is about the rest and digest and make the counterbalance of the flight or fight. And we know that by aging, for instance, the vagus tone decrease, so that we are more potentially, we could be more potentially affected by disease, chronic disease, autoimmune disease like cancer and whatever. And a lot of disease are affected by this imbalance of the two systems, the flight or fight and the sympathetic.
So, nowadays, sorry to interrupt you, but nowadays many people are stressed out. How does that affect the balance between sympathetic and parasympathetic nervous system?
So we know, and we can very easily assess it by a technique based on EKG, which is called heart rate variability. And this can analyze the balance that does exist between the sympathetic, the flight or fight, and the vagus nerve, the rest and digest. And we see that in conditions like mental health conditions, stress, anxiety, depression, the vagus tone is very low, and the flight or fight sympathetic is very high. Therefore, we have the vagus nerve stimulation to put the power of the vagus nerve higher and have a better balance there, and therefore it will improve the condition of the patient naturally. It's natural antidepressant and whatever bioelectrical brain modulation method.
Now let's help our listeners understand a little bit more about that complicated area, because I had the fortune to have a heart rate variability session with you, and of course I knew about it before. There's apps for your phone where you can do it, but there's so much more to what you do than what you get on your phone app. So I was surprised to get a nice printout, and I'll share that printout in the blog that goes with it. And it is very fascinating what all you can read out of that printout.
So heart rate variability is, or an heart rate variability device with Apple Watch or other phone device or watch or whatever, it is not really giving the information we're looking for in heart rate variability. It's good when you are healthy, but when you are not, you can miss the information, and therefore the data are not accurate. So the best way to do it, and it's very cheap, it doesn't take some time, it's through an EKG, because if you have arrhythmia, means cardiac rhythm trouble, which happen frequently in case, for instance, in anxiety, depression disorder, or cardiac issue, then the heart rate variability will not be accurate because of those disorders. So we have to check the EKG, to read the EKG, and then to see if we can use the EKG, if there is no artifact like this, to have a very readable biomarker about the vagus nerve and the sympathetic nervous system, so to get a clear picture of the neurophysiology.
Now, let me ask you, because we have a lot of time today, relatively, what conditions are all correlated or associated with an increased flight or flight or stress response and a decreased vagus tone that will then benefit from your vagus nerve stimulations, where we will later talk about how to do it?
So it was proven that cardiovascular disease, mental health disease, or disorder like anxiety, depression, but also GIT disease like IBS, irritable bowel syndrome, or inflammatory bowel disease like Crohn or ulcerative colitis, are related with a very low vagal tone and high sympathetic. So actually, the vagus nerve is a common denominator of those autoimmune disease like cancer as well, and the sympathetic is high. So with the sympathetic, which is high, the flight or fight, we are living in a very stressed environment, plus stress food and contaminated food. Those affect us, and this will raise the inflammation level that we all have, but in a way that that can lead to autoimmune disease like depression, cancer, whatever disease. So we know that those diseases are associated with high sympathetic, with high inflammation level, high oxidative stress, and in the other hand, lower vagus tone. So we know that. So like epilepsy, like depression, like obesity, like diabetes.
Wow.
Yeah, a lot. So a lot. So lupus, psoriasis, any autoimmune disease, or gastritis, which is due to an imbalance of the vagus tone, heartburn, acid reflux, cardiac issue, are reflecting this imbalance in the flight or fight sympathetic and rest and then digest vagus nerve. And through the heart rate variability analysis with the EKG, we get a very clear picture of the physiology of the patient. So
now, really, Pascal, we have there a tool in the hand that helps many of the main illnesses of our time in an integrated approach. And we both work in integrated medicine. You call yourself an integrative osteopath, which you certainly are, and I'm an integrative health consultant, because we come from both sides. We know the science, we know the alternative route, and you do that as a non-invasive stimulation technique that really helps. Wow.
Yeah, so actually here in Nova Scotia, I introduced vagus nerve stimulation in 2017, doing research about it. It's more developed in the United States and Europe than in Canada. I'm from Belgium, so and teaching neurology when I was in south of France. So I was aware about this. So I was curious of what we can do, so did research about it. And at the time I was the only osteopath or health practitioner in Nova Scotia, but also the province to do non-invasive vagus nerve stimulation.
And that's important. It's non-invasive. It's not that you have to implant something in your bone marrow. For heaven's sake, no. It is just flipping it on, and I probably make a little video showing it how I do it, so yeah, the listeners can see that how easy it is. It just has to be done, right?
Yeah, so it's easy because non-invasive stimulation, so it's non-invasive procedure. So we stimulate directly a branch, not all the vagus nerve, but a branch of the vagus nerve from the ear that goes straight to the brain and then goes down to the body with the vagus nerve. It has the same effect than the surgery, which involve wiring the vagus nerve inside the neck,
yes,
but without the side effect of the surgery. So it has exactly the same effect in a non-invasive way. So it's a very easy way for the patient to do home treatment of vagus nerve stimulation. They can do it at home while watching TV or reading a book or I don't know, doing some light work. And they can stimulate themselves at home a couple of hours a day if necessary. And this is a non-painful stimulation. This is important to say. So they just feel the electricity like vibrotactile or fibrillation sensation. And it's very easy, and it does amazing work, because when I have patient on treatment like this, after a while, the patient come back from heart rate variability, and then we can see that the vagus tone increase, the sympathetic and parasympathetic balance are better, and actually the patient feel better, lose weight, no more diabetics, no more depression or anxiety, or better improvement in Crohn's disease, or whatever. Even I have a patient suffering from migraine, no more migraine, and she had also an essential tremor of the face, so no more as well, because also it affects the cerebellum. So he has a lot of indication and do a nice job.
Now that is really fascinating, and I can't imagine enough that the people would want to do that. Why do some people not do it, or what's the hurdles for some people actually doing the work?
The fact is that here in Nova Scotia, vagus nerve stimulation is something very new. So the classical medical profession are not aware about them. They should be psychiatrists to have a better clue about this. Otherwise, the normal GP, they know what is the vagus nerve, but they don't really know what it does and doesn't know the indication. You have to know that bioelectronical medicine is very new, because it was approved FDA for treating epilepsy in 1988, then in 2002 and 5 in Europe, in the States, for depression. So it's less than 20 years and is very, very new, and the research is just booming about the vagus nerve stimulation because so many potential therapeutic effects.
And I read one of your manuscripts, and it is quite amazing what kind of research you do out here of Nova Scotia, worldwide presenting to an international audience. So here we have a scientist that is in the forefront international in Nova Scotia. Now I'm very impressed, and it's really an easy method, and I may share, and you know that you can do it with a TENS machine, and even with one that you can buy for less than $100.
Yes, correct. I mean, it's just that we are very lucky that the TENS machine, which it's called for transcutaneous electrical nerve stimulation, allow us to choose the right parameter for stimulating the vagus nerve.
Wow.
It is not mandatory for the vagus nerve because the parameters are not set for the vagus nerve stimulation, but those devices are very expensive, but doing the exactly same job. So here is a TENS machine, which is if yes electronic settings possible, so means new TENS machine. So actually, yes, it's very cheap, and we can set the parameters for the patient, and the patient can do the own treatment.
Yeah. So it is really easy. They just have to come to you, get the assessment, see what they need, and you can tell them how to do it. Get them even a TENS machine if that's what they need. And I know you sell those little ear clips. They're kind of cute, but don't look good in a video, but I'll show it. And then they can put it on when they watch TV or work on the computer or read a book.
Yeah, exactly. And I mean, more and more patients, because, you know, they are more interested about mindfulness therapy, because mindfulness therapy also stimulates naturally the vagus nerve. There are other natural way. Pay more attention to what they eat, and they check on internet about the vagus nerve, and they found my name for the non-invasive vagus nerve stimulation. And I have some patients coming from PEI, from New Brunswick, from Ontario, from even from BC, just coming to see me for their condition that classical medicine will only offer medicine with side effect, and they know that with vagus nerve stimulation they can improve without the pills and side effect of the pills. So
now, you noticed side effects. Does vagus nerve stimulation have any side effects?
Yeah, there are. The side effects are very rare. So vagus nerve stimulation, either the invasive or non-invasive, and more the non-invasive has less side effect. It's very safe and well tolerated. So this is the point. So it's a very safe treatment. So, but some side effect can appear, mostly because vagus nerve stimulation is immunosuppressant therapy. So therefore it works for autoimmune condition, right? But by dumping down the immune system, maybe the patient in the winter time can maybe more fragile for virus and get a flu more easily because the immune system is quite damp. But this is very temporary, and the patients stop the treatment while they are sick and resume the treatment afterward. So, but those are very rare. Some patients may have some headaches during the stimulation, but we adjust the parameters, and therefore it works well afterward. And mainly the side effects, apart from the immune one, is just during the stimulation. So after when the stimulation is done, the side effect disappears. So it's very safe and very well tolerated.
And I like that it is non-invasive. So as a client or patient, you control it. So if it's getting uncomfortable or hurting, you can reduce the frequency, you can take it off the ear. It's not like if you have it implanted, you are a subject or a victim of the stimulator. And if it malfunctions, you can be in serious trouble.
The problem with the invasive, it's a very good idea. The fact is here in Nova Scotia, I don't know the other province, but it's only covered by MSI for treating drug-resistant epilepsy.
Yeah.
Although in the States or in Europe, it is also covered by the insurance for depression, because it's approved FDA as well for depression. But
Yeah.
although it's approved for migraines, diabetes, or other condition, it's not taken in charge by MSI. So if you go for surgery, it will cost you $15,000. And here with the non-invasive way, giving the same results, it costs you maybe less than $200 for the home kit.
For the home kit. And
Stimulation.
that is really amazing that you can get the same results for way less money and less trouble, because non-invasive is always better. There's no risk of infection.
Correct.
Oh my God, there's no risk of nerve damage. Like the other way, you can get nerve damage and all that. And I mean, the cost, even if it's covered by MSI, to the medical system is not necessary. And yes, the advantage of the invasive is that you have no control, so it works. The other way, you have to take control, you have to take charge of your health, that we both advocate for, and actually put it on your ear and do it, or it won't work.
Yes, and there is another non-invasive alternative of the vagus nerve stimulation, which is called transcranial magnetic resonance. So put a coil in the head. So actually it does the same work of the vagus nerve stimulation, because the vagus nerve stimulation is a thumb-bottom stimulation in the brain.
Yeah.
The transmagnetic cranial stimulation is from, because it's here, it's a top-down stimulation.
Yeah.
It do the same job, but it's more expensive because the machine is expensive.
Yeah.
And it requires a lot of treatment. You cannot do at home. You have to go to the clinic for this. There is one new clinic operating now in Halifax with a colleague psychiatrist. But for the patient, it's very expensive, and it's not taken in charge so far by MSI. So the cheapest solution now, it's non-invasive vagus nerve stimulation.
Yes. And I mean, of course, all methods have to be in context with changing your lifestyle and changing your nutrition, adding what you need. Relaxation techniques always help. It all goes together. That's why we do integrative medicine. We integrate it. But when you spend thousands of dollars to get an expensive machine, or you spend $200 to clip it on your ear at home, hey, that's not a choice for me. I can't get that. The health system doesn't pay for that, really.
No, it's very nice. But of course, as you say, we need to educate the patient. So vagus nerve stimulation doesn't do any miracles by this. We have to control the hormones balance as well, yes. Because hormones act like neurotransmitters. So it's very important. And also they have to change their diet to help to lower down the inflammation in the body, like taking some probiotics if they have gut disease or something like this. And also their lifestyle to try to do more exercises. And but the vagus nerve stimulation, you have to know it's a slow process. So you cannot expect miracles like this in few sessions. Yes, for some patients, we did some miracles. No more chronic migraines for ages in only 8 stimulations. So this is awesome. But otherwise, for very chronic condition, it may take some time. And I'm talking, for instance, for a very severe major depression, which for even the medicine doesn't work anymore. Vagus nerve do the job because it will stimulate the production of serotonin, norepinephrine, dopamine naturally, but this takes time, and also it will reduce the addiction. So it's also indicated for addiction troubles like sugar, salt, whatever
even alcohol,
can have. So it works as well for this, because it's very important to remember that vagus nerve stimulation, actually, because the vagus nerve modulates almost 80% of the total volume of the brain, which is huge, he has a lot of neurophysiological effect at the end.
So tell me, how long does it take on average before you see an effect, and how do you measure if it has an effect?
So, like I said, I had patients suffering from, for instance, very, very painful trigeminal pain. They just came like this without any anatomical reason behind this, but trigeminal pain, which is involved, affected the one of the branch of the trigeminal nerve, for instance, in the jaw. But we know that the trigeminal nerve and the vagus nerve are very close friends. So by stimulating the vagus nerve, we do input on the trigeminal nerve and nuclei as well. So a patient suffering from very severe trigeminal pain, also suffering from food allergy, also suffering from gastritis, in 8 sessions, lasting 45 minutes per session, she didn't suffer anymore from trigeminal pain and no more gastritis and recover for food allergy. So the vagus nerve stimulation is just spreading the balance of the body in everywhere. So it's not only for effect for the trigeminal nerve, but also affect her stomach and also affect food allergy, because he modulated neurotransmissions and because he dropped down the inflammation. So this was a good result. Another one suffering from chronic migraine since 20 years. In 8 sessions, it was no more migraine. But if you are a patient suffering from anxiety, depends if it's severe, moderate, or what else, it may take more or less some time. Of course, if you suffer from very severe major depression, it may take months, but you will improve. And therefore, every 3 months, we check the heart rate variability to see the balance of the flight or fight and rest and digest. And we can see and show the patient how they improve in their neurophysiology. It's not about just subjective feeling, but we can link the objective biomarker of this balance through the subjective feelings of the patient.
Now that is really amazing. And before we get to the end of the show, I would love for you to share how clients, patients can take a hold of you. How can they find you? Where can they find you? How can they book an appointment with you? How can they get the benefits from that amazing stimulation, non-invasive at home for a really ridiculous low amount of money?
Yeah, so I'm an osteopath, so I'm educated in UK, master degree in Switzerland, working in neurosurgery department. I did my test there, and specialized in neurology and interesting in neuroscience. Of course, related to the vagus nerve and heart rate variability. Because also I am classical osteopath. So I'm practicing in Eastern Passage at the Eastern Passage Wellness Center. So the patient can find it very easily through Google. It's a main road in Eastern Passage.
I'll put the link under the video and I'll put it on the podcast and website. Right. Absolutely. So they can directly click on it and find you right there, because it is so important that we bring that out under the people before they spend thousands and thousands to get better and may or may not. Why not try a relatively cheap and proven method that may just do the trick?
So a patient coming here, it's a full assessment. So, and in the assessment, of course, maybe there is questionnaire and to assess the severity of their problem. And I do an EKG. It's just 10 minutes record EKG. It's not that long. And this should be in the morning for physiological condition. And then I process the analysis and And then, depending of the severity of the imbalance, I can offer the patient to try the vagus nerve stimulation, non-invasive one, and then the patient come here in the clinic for several of sessions. So therefore, I can check if there is no side effect in between the treatment, if it is well tolerated by the patient. And after a couple of sessions, we do another assessment to see what we gain in the neurophysiology, and then we can think about home treatment if the patient needs further vagus nerve stimulation.
Now, that is really amazing. Thank you so much for being on the show and sharing this, which is in Nova Scotia and Canada, cutting-edge science, but is well known across the world, but is still relatively new. And I think it's superior to implanting vagus nerve stimulation or doing even the cranial TMS.
But I mean, it's not superior. It just does the same job. So there is no other physiological difference between invasive and non-invasive. The fact that if you want invasive, so there is surgery, you may have the side effect of surgery, could affect your voice because it's just there close to the voice. And also it costs you $15,000 minimum for this. And a lot of patients doesn't need the invasive.
Right.
Okay? But a lot of patients suffering from moderate to severe could be very well improved, take some time for some, but very well improved in a global way to all their condition with the non-invasive. Because when you have a condition like this, it's just, you don't have only depression. It's there is other comorbidities like means others part of your body that is affected, like your digestion is not good because there is, the well-known now brain-gut axis.
Brain-gut axis, exactly.
And also the brain-heart axis, and therefore you may suffer with depression, with symptoms affecting another part and other troubles. So you may have fibromyalgia plus anxiety plus IBS. And therefore chronic pain all together because there is a trouble in neurotransmission in the brain, and with the vagus nerve stimulation, it will help to remodulate the neurotransmission in your brain and to decrease the neurotoxicity there.
And I said superior because in my opinion it is, because it is less risks, less investment. Why not try that first?
But I mean, after it needs to have a very well assessment of the patient, and if the patient might need the surgery, I had referred two patients for surgery because some patient needs to get 12 hours of stimulation a day, and with the non-invasive one, it's quite difficult to do it at home for 12 hours. But most of the case, they don't need 12 hours. Some patients I have maximum, they stimulate themselves 3 or 4 hours, that's it. And this is manageable and does a very, very great job.
Yes, and it's important to know that we are not opposed to the surgery and the transcranial magnetic stimulation. These are all options that may or may not apply. But as I said, why not try the cheap and non-invasive first? And then if you feel, yes, you have to do it for 12 hours or longer, you refer them and say, okay, that's not something I want to address. You need more than that. So there you go. And that's fair.
If there are here in Nova Scotia, the non-invasive is just recent, and it's only for very severe epilepsy, and no other one. So it's very restrictive, and if you don't suffer from severe epilepsy, but you have epilepsy, you will not be a good candidate for surgery, but a very good candidate for the non-invasive way.
Right. And that's a good place to close the show. Thank you so much for being on again, Pascal. It's always a pleasure to talk to you.
Welcome. Thank you very much for inviting me. And I hope that I gave the audience more explanation about what is the vagus nerve and what is the vagus nerve stimulation and for which condition it could help. Anyway, everyone interested or may think he could benefit from this can contact me.
Please do. I highly recommend Pascal. He is not just very knowledgeable, but he's also a great guy and a good person. And for all those that watch that, make sure to check back next week for the next episode. Bye-bye.
Bye-bye.
And this brings us to the end of today's show. Please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact me, my email here is christine@communityradio.ca, or you can contact me through my website, docchristin.com, docchristin.com. I'm always grateful for any feedback. You might not know this, but this is a volunteer-run non-profit radio station, and we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.